are some troublesome signs in some parts of the province, namely in Kingston and Windsor, Essex. They've seen a spike in cases recently. We're going to take a closer look at all of that coming up, but let me bring in my colleagues to help set up the Prime Minister, the host of Power and Politics, Vashi Kapellas, and the CBC's Catherine Cullen. So as well as those two sort of hotspots in Ontario, one of them related to migrant workers, and in the case of Kingston, we're going to talk to the Mayor of Kingston in just a moment, an outbreak that started at a nail salon. There is also what is happening in the United States, which continues to be very troubling, obviously, for Canada, even though the border remains closed to non-essential travel. Vashi, I'll maybe get you to start off there and anything you know about what the Prime Minister is going to say today.
For sure. Well, I'll start off, as you mentioned, with what's happening south of the border. Obviously, the restrictions remain in place till nearly the end of July between Canada and the United States at the border. But those, I think we've kind of been saying the same thing over the past 2 weeks. Every time I turn on the news in the morning, at least south of the border, you're seeing state after state report increases in the number of cases, but not only the number of cases, in the number of hospitalizations as well. A place like Arizona, for example, where they're, hospital workers and doctors and nurses are particularly sounding an alarm about reaching capacity in many of the hospitals in their ability to even treat some of these patients. Obviously, a very worrying trend because though the economies in those states opened up much faster than they did here in Canada, province by province, but also there are less restrictions, I guess, still in place in many of those places. And so I think there is a desire, I'm especially looking towards not only what the Prime Minister has said, but those modeling numbers to try and figure out, well, what can we glean from the information there that might impact the forecasts or our ability to mitigate the spread of the virus here. And in particular, one thing that I think is going to be interesting to zone in on and what I want to know more about is the rise in cases among young people, because that is something that we have seen be especially pervasive throughout the United States, in those states in particular where we are seeing the spike in cases and spike in hospitalizations. Now, the mortality rate is not necessarily going up, so that young people aren't dying from the virus at this point to the same degree that older people are, and we know that to be true to a certain extent in Canada as well. But the problem, of course, is even if you're asymptomatic, even if your symptoms aren't that bad, you can then transmit the virus to someone who could very much have a dire consequence because of that, or pass away, or just suffer a lot more than a younger person does. So now we have seen in some provinces, I'm thinking of, I know in Ontario, I know in Alberta as well, a majority of newer cases are actually among younger populations, which does echo some patterns we've seen emerge in the United States. I don't know if it's going to have the same outcome, but I'm really curious to hear from Dr. Tam what the modeling shows her about that. And also just setting against the backdrop that you mentioned, Rosie, the economies, which, anyone who went outside this weekend or who saw people for the first time or the second time, right? Like, we all feel it. Things are certainly relaxed compared to what they were a month ago or 2 months ago. But what kind of effect is that going to have on the spread of the virus? How, as you mentioned, we saw in Kingston, for example, what happened there. How are we dealing with incidents like that? What kind of overall effect does it have on the trajectory of the virus in this country in particular? It's been, I think, June 4th, correct me if I'm wrong, was the last day that the modeling was released. So we're about a month past that. I think June 4th was reflective of kind of almost a different society, right? One where we were still very much, at least in the month preceding that lockdown. This will be, I think, a different look, more based in the kind of way of life that we're going to have over the next few months, at least, unless there's a potential second wave. So I am very curious to see those numbers. And on the Prime Minister, there's a lot of stuff going on, not all of it COVID related, so I'll wait to weigh in on that.
I will just talk about the young people, because Phil, my trusty producer, pulled out some numbers, and we're not sure if they're actually new. They could be new numbers. They're recent numbers anyway. I'm not sure if they're the numbers we will get at noon, or if they're new numbers. Where it does say the highest incidence rates in age and gender remain in Canadians over 80, which is what the trend we've been seeing from the very beginning. But also, as you rightly point out, Vashi, younger adults aged 20 to 29. They now represent 22% of the cases reported in the last week. And people in that age category, 22 to 29, comprise just 14% of the Canadian population. So we've seen some stories out of Hamilton. We've seen it in other places. There's certainly something going on there. And it does seem to be the case in the United States as well. And I don't know if it's because people are feeling relaxed, are no longer following the public health advice the same way because the things have been eased. I'm not sure what that's about, but there is definitely something going on, something troubling and something to watch, as you rightly also point out. Doesn't mean the same number of deaths for young people. They usually don't have the same kind of, it's usually not as severe a case, but it's still something very much to watch. I'll bring in you, Catherine, on that point, or what you're expecting from the Prime Minister. I know you did some work on Friday around the bid to try and get students to do volunteer work, and that story continues a bit today as well.
That's right. In fact, the Conservatives trying to push this issue forward over the weekend, certainly writing to the Auditor General and saying they want scrutiny of this program, the Canada Student Service Grant Program. Folks may remember that that's about a $900 million program. And the aim is to get students across Canada, many of whom would have hoped to have summer jobs and are not finding them, to put them in touch with charity organizations. They will be paid for that work, somewhere between $1,000 and $5,000, depending on how much work they put in. Now, the group that is administering this program, it's actually not the federal government. They put a group called the We Charity in charge of this. People may know, they may be able to cast their minds back all the way to 2015 when Justin Trudeau made his very first speech, actually, after being sworn in as Prime Minister. First big public event was one of those We Day events where he was speaking to crowds of thousands of young people, getting his message out. Now, the Prime Minister doesn't get paid for his work, nor does, we should say, his wife or his mother. They're also associated with this charity. But the Prime Minister was asked on Friday, is there some impression that could be left of, for instance, favoritism, preference, conflict of interest because your family is so close with this charity? He defended the decision to give this charity this contract, saying, listen, this is what departmental officials told us to do. They said that this is the only charity that could handle, the only organization that could handle work of this nature. So finding positions for all of these students, getting them connected with it. But the questions remain. The Conservatives now saying it needs scrutiny by the Auditor General, talking particularly about the outsourcing of the program to a third party, saying it raises a justifiable concerns and a number of questions, and then, of course, raising those connections between the Prime Minister and his family. So he has defended that. Since then, though, we're hearing about other concerns as well, we should say, Rosemary. I know I've received emails, I believe you have too, perhaps Vashi as well, from students and others, labor lawyers and whatnot, questioning the nature of the program itself. Why give students a sum of money, but not pay them, for instance, the minimum wage? Because, of course, if you break it down, it is less than the minimum wage. You know, some people, well, I think people generally applauding getting students out into the community, but questioning whether or not it's appropriate to be giving them some money, whether that muddies the sense of volunteerism, but not enough. We've heard the government defend that and say, listen, this is a tough time. These charities need help. This is a way to help them. Students need additional money. This is encouraging work in the public service. But the questions continue to pile up today, and I think the Prime Minister may be facing more of them today as well.
Yeah, I mean, worth pointing out that this is a volunteer position, so you wouldn't normally get money, and the government, I think, trying to, as you point out, deal with two issues at the same time. One, charities that need labor at a time when pandemic is happening across the country, and students who are looking for work and the work isn't created. I think you have some new numbers, though, on the number of people, too, that have reached out and put their hand up and said, yeah, I want to do this. Yes,
and it also actually, interestingly, sort of loops back to the concern by the Conservatives. So the government has some numbers, and I think we're going to hear more about the Prime Minister from this today, but what they see as good news numbers, 25,000 applications that they've received. I believe the applications opened on, I'm going to say, Thursday was when the Prime Minister made his announcement. So they were hoping to get 20,000 students placed. They've already received 25,000 applications. They certainly look at that as good news. I know they received 1,000 in just the first few hours. So the demand is there. A lot of students are eager for these opportunities and the money that comes along with it. But what is interesting about that is as WE's involvement in this whole project is scrutinized, of this $900 million plus program, according to the information we've received from the government. Now, WE is not going to make any kind of profit, the Prime Minister said on Friday, but they are getting paid to administer the program, and that amounts to about $19.5 million. About $5 million of that goes to other agencies, but that number can keep going up if there's more interest in the program, if the program itself expands. Certainly these latest numbers, it's only been a few days, suggest that the interest is there, therefore the program can expand. The other trick, though, I would say in all of this is, are the opportunities there? Because we know that that's something that other groups such as Volunteer Canada, which people who've been listening to News Network, our colleague Janice McGregor, have heard her talking about today, but have said that they have a concern, amongst other things, not only about muddying this sense of what volunteerism is, but also of having a rush of people offer up their services and then not actually have a spot for them, and that they fear that in the long term that dampens people's sense of enthusiasm. So it'll be interesting to see how that part of this plays out. It is quite a multifaceted issue, and there are a number of concerns being raised. But as I said, the new numbers do suggest that there's also a lot of people very interested in this.
For sure, and that might be the encouraging part, I guess, for the program and for the government to see young people wanting to help out at a time when so many people do need the help. Okay, we are standing by for the Prime Minister coming outside of his home in about 4 minutes. So let me do a quick interview while we wait for him, because as we talked about there, Kingston, Ontario is dealing with what we'd call certainly there a surge of new COVID-19 cases after an outbreak at a nail salon. Brian Patterson's the Mayor of Kingston, and he joins me now. Good to see you, Mayor. Thanks for making some time.
Thank you. Good morning.
Good morning. So I know that you're having there is a press conference by public health officials at 1 to update us on the situation, but maybe you could give us a hint of what we should expect. How big is the problem right now in Kingston because of this outbreak?
Well, we are definitely seeing an increase in cases. We expect that number to go up for the next little while. But at the same time, it was good that we caught it early. So we've done a ton of testing. There have been hundreds of people that have come forward and doing the tests, making sure that we're doing the contact tracing, all of those best practices that we know were important. And I think that that's what I'm hearing from my public health officials, that, you know what, this was only a matter of time. We're going to see these outbreaks from time to time as we live with COVID over the next year and a half. And so the key is to catch it early and to move quickly, get that testing done. And so, so far, what I'm hearing is that it's not great, but it could be a lot worse.
Yeah, I think the last thing I heard this morning was 3,000 people have been tested, all related to this contact tracing, which is what you're supposed to do, of course, when you get this. I'm just wondering how many cases you now know are confirmed to this outbreak. The last number I had heard on that front was 25. Is that still the number?
That's right. So that's the number we have right now. I'm going to have a call very shortly with our public health officials to see if any new cases have come. But again, when we're testing that many people, we are expecting that there will be more positive cases. But again, this is just one of those things where we're just going to continue to update it, work with the community, make sure that everybody that has been to that nail salon gets tested. And again, when you're talking about 500 people that have gone to that nail salon last 2 weeks, it's a lot of people to identify, but the response in the community has been great.
So you are doing an enforcement sort of blitz right now at spas and nail salons and other things to make sure that they are practicing the right kind of public health advice. Should that not have been done proactively, or was the onus sort of on businesses to do the right thing?
Yeah, I think to be clear, public health had done a really good job about letting all these businesses know exactly what the guidelines and what the rules were. In this particular case with this nail salon, unfortunately, some of those rules and guidelines weren't being followed. And so that's where the inspection is going forward, to make sure that everybody else is following those rules. And if not, then they will be fined. Our medical officers have said that if they find more cases and further problems, that they may even issue an order to close nail salons. So that's obviously something where we identify it's a higher risk activity. Yep. You know, you're talking about being in close contact with someone for about an hour. That's something where we have to make sure that those guidelines are put in place.
Well, would you not, I understand you're obviously taking their advice, but would it not be perhaps prudent to shut down all salons and then do sort of the inspections to make sure it's happening? Because there's now 2 or 3 salons that have had some violations.
Well, we've already done a blitz, and I think we've hit just about all the salons in the city. And so we'll connect and see if there are further problems, and we have to take action. We're certainly willing to do that. But, you know, I think it's one of those things where it's a wake-up call for the community to say, you know, we've gone through a couple of months with hardly any cases at all, and to understand that, you know what, we have to be careful. We have to stay vigilant, that we're living with this virus. It's not going to go away. And as long as we do that, then we'll be in good shape.
Well, is that maybe part of the problem? Because I know Kingston has been sort of a success story, certainly in Ontario, in terms of containing the virus. Do you think maybe people let their guard down a little bit?
Well, I think in this particular case where the public guidelines weren't being followed, that probably is an indication that maybe some people had their guard down. So I think a wake-up call is a good thing, to understand that, you know, again, this is what I'm hearing from our local public health people, that we're going to have outbreaks like this, you know, until we have a vaccine. And so we have to make sure we can't let our guard down, that physical distancing and hand washing and, you know, now wearing masks, that those are things, they're there for a reason, to make sure that we can prevent the spread of any new cases.
And you actually have now, the health units issued an order on mask wearing in Kingston, right? So give me a sense of where you expect people to wear masks now.
So we've issued an order that masks should be worn inside any indoor public spaces. So this would mean, like, if you're going to the grocery store, if you're going to a mall, if you're going to the library, community center, if you're riding public transit, for example. And actually the response has been pretty good here in our community. I was at the grocery store just the other day. Everybody's wearing a mask. I think people are taking it in stride. And I think given the trade-off, if you'd rather have something shut down or would you rather be wearing a mask, I think most people say that this is a better route to go. So I think the big challenge right now is finding one. I think just about every store that was selling masks has sold out of them. But I think that getting that uptake from the community is a really good sign.
Yeah. I want to ask you about another issue, if I can, before you go, and that is about recreational boaters, because I know that customs officials had warned about this, and I mean by this, Americans coming across on the water, for recreational reasons into Kingston. Is that actually happening? Have you seen evidence of that? How concerning is that for you?
Well, I mean, obviously that's a violation of the rules that are in place, and so we have had people raise those concerns. We have been and have had people on the ground that have been doing inspections, certainly of marinas and other places, to make sure that isn't happening. And what we're encouraging people is that if you see something that is concerned, to contact Border Control directly. But obviously that's what we're trying to abide by those rules.
Yeah. Okay. Mayor, thank you for making the time. I appreciate it very much. And we'll, of course, bring people the news from the briefing later as well today. Thank you.
Thank you.
That's the Mayor of Kingston, Ontario, Brian Patterson, as I talked about there. An outbreak that started, benignly in a nail salon in Kingston has now led to the city testing more than 3,000 people. The case load is still, positive cases, still quite low. But that's the kind of thing that everyone needs to be aware of, that it can happen, and then public health officials have to be able to go in and test and contact trace very aggressively, as we see they're doing in Kingston. The other place where the tests are certainly a source of major concern is in Windsor, Essex. Again, we talked it last week, if you were watching this special last week, about migrant workers after the death of a third Mexican migrant worker in southern Ontario. And now, as of today, there are 117 new cases of COVID-19 in the region of Windsor, Essex. And I should point out that my colleague Chris Ensing also says that of all the cases in that part of the region, more than 40% of them are in the farm sector. So obviously there's a push to try and get migrant workers tested and make sure that they are being well protected, but there's a real sense of vulnerability in that industry, as well as that part of Ontario continues to track and trace. And there are other little hot spots through the country as well. Saskatchewan has seen a bit of an uptick, Manitoba has seen a bit of an uptick, and some of that is to be expected as restrictions are eased, but it is still something that we should all be keeping an eye on. I'll bring back my colleagues as we wait for the Prime Minister. Generally, Vashi, I bring you back and then the Prime Minister emerges, but we'll try it anyway. Yeah, I mean, you can go where you want with this because we've already talked about hotspots, but it is interesting to see then how public health officials respond to these kinds of things and how quickly you can contain it, which is really what the goal is.
Yeah, and if I can zone in on the migrant worker aspect, because I do think there might be some questions for the Prime Minister on that. The outbreaks, particularly in a couple areas of Ontario, there's kind of shared jurisdiction over how this file is handled, and in particular, how to mitigate the spread of the virus among migrant workers. I know he's coming right now, but the federal government does have some jurisdiction here, especially around congregate living situations, which is a huge part of all of this.
All right. Here we go. Here's the Prime Minister of Canada. Thanks, Vashi.
Our government has been focused on keeping Canadians safe and making sure people are supported during this challenging time. And as we move into the summer, this work continues. While we've made good progress over the past few months, the virus remains a very serious threat to our health. And with parts of the economy shut down for many months, a lot of people need help getting back on their feet. So we're going to continue helping in every way we can. Our government has launched new programs and made new investments to help businesses reopen safely, get people back on the job, and lay the groundwork for our economy to come roaring back. If you own a business and you're struggling with cash flow, you can get a loan through the Canada Emergency Business Account to bridge to better times. If you're a student or a recent grad looking for a job, we've created thousands of new work placements through Canada Summer Jobs and the Student Work Placement Program. And if you're an employer and you need help to bring back your staff, the Canada Emergency Wage Subsidy is there for you through this summer. In every part of the country, business owners are stepping up and hiring back their staff, from Brook Signs in Brantford, Ontario, to Anchor D Guiding and Outfitting in Turner Valley, Alberta. And moving forward, our government will help even more businesses bring back their workers.
Life is slowly starting to return to normal, and this is good news for everyone. But the recovery also presents new challenges. Our government continues to follow the situation closely and to listen to Canadians. We want the programs to be adapted to people's needs and realities, and that's why the federal government intends to extend by 1 month the Emergency Commercial Rent Assistance Program, and we're working with the provinces and territories to make that happen. This program allows thousands of small businesses right across the country to pay less for their rent. We understand that many owners have problems with cash flow right now, and we're working on that this week.
Intends to extend the Canada Emergency Commercial Rent Assistance by another month, and we're working with the provinces and territories to do just that. This program is helping thousands of small businesses across the country save on rent. We know that many business owners are struggling with cash flow right now, so we're working on a solution. With summer officially here, I know a lot of people are wondering what to expect for the coming months. So this afternoon, Dr. Tam and Dr. New will release the latest public health modeling. We'll have more details then, but here's the main takeaway from these projections. After a very challenging spring, things are continuing to move in the right direction. We still have some hotspots in some parts of the country, but nationally, the number of cases, hospitalizations, and deaths is declining over time. And that's because Canadians are doing their part. You took this seriously. You followed public health instructions and made sacrifices so we could get this virus under control. Over the coming weeks, we're going to keep regularly updating Canadians on how this virus is progressing, as we have since the beginning of this crisis, including with the latest numbers continuing to be published every single day. As we move into this new phase, however, Dr. Tam, Dr. New, and I will provide an update on the pandemic a few times a week instead of every day when we have briefings or information to share. I want to stress, though, that while we're on the right track, the fight against COVID-19 is not over yet. As we start to reopen parts of the economy, we must continue to follow local public health guidelines to keep each other safe.
This afternoon, Dr. Tam and Dr. New will be presenting the latest projections from public health. There will be further details provided at that time, but this is the major takeaway. After a difficult spring, things continue to improve. We do have hotspots in Canada, but across the country, the number of cases, of hospitalizations and deaths is declining. And that's because Canadians are doing their part. You took the situation seriously by following public health advice and by making sacrifices. In the coming weeks, we will continue to update you on the latest developments as we have been doing from the outset. The latest data on COVID-19 will continue to be published every day. But given that we are now entering a new phase, Dr. Tam and Dr. New and myself will be holding updates only a few times a week, but not every day. I want to be very clear, however. We have made significant progress, but we're not out of the woods yet. We have to remain prudent and continue to follow public health and experts' advice.
Canada Day right around the corner. We have another busy week ahead of us. In addition to our ongoing response to COVID-19, the new NAFTA will come into force on Wednesday. With trade between NAFTA members valued at nearly $1.5 trillion in 2018, we can't overstate how vital it is to maintain free and fair trade between our three countries. Millions of jobs depend on a strong and stable relationship with our partners. This deal secures access to the North American market for our business owners, entrepreneurs, and consumers. It removes uncertainty for our manufacturers, our investors, and our workers. This deal is good for Canada and good for Canadians. Sur ce, on passe maintenant aux questions.
Now we
Merci
will
beaucoup,
take
Monsieur le Premier
questions.
ministre. On va commencer la période de questions au téléphone aujourd'hui. Opérateur, c'est à vous.
Thank you, merci. Première question, Michel Lamarche, TVA, à vous.
Oui, bonjour, Monsieur
Good morning,
Trudeau.
Mr.
J'aimerais
Trudeau.
d'abord
First of all, I'd like you to comment on the criticisms made by the Quebec Labour Minister of the CERB. Apparently, the extension has not helped to relaunch the economy. What do you think of his analysis? He is saying that that is hindering the reopening of the economy rather than boosting it. Well, there are thousands, in fact, millions of Canadians out there who don't have a job and want a job. And because the economy has slowed down and was at a complete standstill for several months, there are no jobs there for them. So we have to continue to provide them the necessary help so that they can support their family and buy their groceries. That is our priority. Yes, the economic recovery is important, and we have seen many companies, many businesses using the wage subsidy in order to assist that recovery. But we are still in a situation where too many Canadians still need the CERB, and therefore we decided to extend it. Follow-up, Michel? Yes, I'd also like you to comment on what's happening south of the border in some U.S. states where we're really seeing a sharp rise in the number of COVID cases. Today, are you able to reassure Canadians by telling them that the restrictions at the border will remain in place past July 21st? Well, first of all, the restrictions at the border will continue to be in place, and we will also continue in the coming weeks and the coming months talk about the next steps. But right now, those restrictions remain in place until July 21st. In terms of what's happening in the United States, I think we have to learn from the challenges other countries are facing. So yes, even though we are slowly reopening the economy, we must continue to take the right steps, wearing a mask when we can't keep a 2-meter distance from others, being careful about contact with other individuals if we don't want to lose all the progress that we have made in the recent months. We will simply have to continue to be vigilant even as that new phase begins.
Obviously, we're going to continue to put the safety of Canadians at the very top of our priority list, which is why we have extended the border measures with the United States until July 21st. And we will continue to assess the situation, work with the Americans on what steps need to be taken into the month of August. What the situation we're seeing in the United States and elsewhere highlights for us is that even as our economy is reopening, we need to make sure we are continuing to remain vigilant, individually and collectively. That means continuing to wear masks when we can't keep 2 meters apart, continuing to be careful about coming into contact with people, continuing to practice what the public health officers are recommending in your regions. We need to continue to be careful even as we reopen so that we don't lose all the significant progress we've made through some very difficult sacrifices by Canadians over the past months.
Thank you. Operator, next question over the phone.
Thank you, merci. Next question, Kate Bottomgaro, Bloomberg, line open.
Hello, Prime Minister. I am wondering about how your government has rolled out some of these COVID-19 programs. There has been some criticism about how the response was handled, and I'm wondering if you could get a redo on this response, what would you have done differently?
Oh, I think there's certainly plenty of things we would have done differently, some things we might have done a little sooner, some things we might have done a little later. But we've spent very little time analyzing, wishing we'd done things differently. Those reflections, of course, are ongoing and will continue to be ongoing so that we're better positioned for a potential second wave and moving forward. But throughout, we have done our very best every step of the way to make sure that Canadians were supported. And on that measure, we were successful. In terms of the support to the CERB for over 8 million Canadians who needed it, we were able to support families who then were able to lock down, and that helped us get to the place we are right now of an extremely flattened epidemiological curve. We know that there's lots more work to do, and we're going to continue learning from what we did well and what we perhaps could have done better. But in general, I think certainly when we compare to other countries and when we look at what the OECD said about Canada having had a rapid and substantive response, we know that we've done pretty well.
Of course, in the coming months, we will have a lot to think about in terms of whether we could have done certain things differently or sooner. But the fact is that we did the right thing at the right time overall in order to help Canadians to stay home and continue to pay their groceries and keep our economy sufficiently intact to be able to reopen it now. Businesses got support. That support for businesses and families has worked, and we will learn from what we did in order to better respond in the fall if there's a second wave.
And it's great that you mentioned the possibility of a second wave. I'm wondering, what is the government's capacity to respond, given that the economy has already been shut down for several months and that spending has been increasing due to the COVID-19 response programs?
We went into this pandemic with one of the best balance sheets in the G7, and we were therefore able to give people the support necessary as we get through. As always, we will prepare ourselves for the worst possible scenarios, but we will hopefully see the best possible scenarios. We know that we're going to be working very, very hard to continue the testing, the contact tracing, including across all provinces. We'll be rolling out an app soon that will be an extra layer of support for Canadians to be able to keep themselves safe. But on top of that, we also know that if we do get hit in certain regions or across the country in the fall, we will be able to respond with sufficient fiscal room to be able to do that. Okay.
We know that we always have to prepare for the worst, but hope for the best. So if there is a second wave that could hit us hard, well, I think then our investments in more testing and contact tracing will allow us to respond quickly if there is an outbreak in the coming weeks and months. So I think that's the right approach to take under the circumstances. At the same time, we have had one of the best balance sheets of any of the G7 countries at the time that we entered this pandemic, and that is why we were able to help so many businesses and families get through these recent months. If ever we find ourselves in difficult circumstances in the fall, we will have the capacity to continue to provide help. But as I said, we want to ensure that what we have in terms of current measures or measures in place will, if possible, prevent a second wave.
Thank you, merci. Next question, Michelle Carbert from the Globe and Mail. Line open.
Hi, Prime Minister. Thanks for taking our questions. This question is about Canadian foreign fighters in Syria. Despite your government's claim that it is too dangerous to send diplomats into northeastern Syria to repatriate these Canadians, more than 20 countries, including the U.S., France, and Germany, have repatriated their citizens from northeast Syria. Why can't Canada do the same and take responsibility for its citizens?
We continue to engage in consular cases around the globe. The situation in Syria continues to be extremely dangerous. There are countries that have presence on the ground in Syria. Canada is not one of those countries. We will continue to ensure that we're keeping as a priority the protection of Canadians working abroad, particularly in this COVID context, but in every context.
We will continue to work to help Canadians in difficulty right around the world. In Syria, there are many, many countries that are on the ground. Canada is not one of those. It is not on the ground in Syria, but we will continue to try and help Canadians while at the same time recognizing that the health and security of the members of our diplomatic corps must be our top priority, particularly in the middle of a pandemic, but at all times.
And as a follow-up on another subject, Liberian warlord Bill Horace, who has been accused of committing murder, torture, and rape in the early 90s, was recently shot dead in London, Ontario, after living in Canada for almost 2 decades without facing charges. Why did Canada fail to bring him to justice?
This is a question on which we will be following up as a government.
Merci. Merci. Opérateur, dernière question au téléphone.
Thank you, merci. Prochaine question. François Carabin, Journal Métro. À vous.
Oui, bonjour.
Good morning, Mr. Trudeau. I'd like to quickly come back to what was mentioned earlier and Quebec's position. There have been some criticisms of your programs, and they are saying that the CERB is not assisting certain sectors of the economy. Is this something you wish to reflect on, possibly? The CERB was extended because there are still millions of Canadians who want to work, but for whom there simply are no jobs available. So yes, we have been here to support entrepreneurs and businesses, but our priority must always be Canadian families and workers, and that is the choice that we made. We are encouraging the businesses that can to use the wage subsidy in order to bring back their workers. We are encouraging the economy to reopen gradually and as quickly as possible, but at the same time, we will always give our top priority to people in this pandemic, and that's exactly what we've been doing. Follow up? Yes, thank you. Now, on the question of a vaccine, we're still far from having one, but if a vaccine were to be developed, and there was one, what is the power of the federal government when it comes to imposing a vaccine, since very high levels of vaccination will be needed to beat COVID-19? Well, I think we're very far away from that scenario. I said that when and as soon as a vaccine is available, people will not be forced to be vaccinated. First of all, there must be enough vaccine for everyone, and that is what we are working on now. We actually have partnerships with many companies here in Canada and around the world to make sure that we can make a strong contribution to developing that vaccine, and then afterwards produce enough of it in order to help all Canadians as well as vulnerable countries around the world. That's our priority. And I am confident that Canadians, as always, and as they have throughout this pandemic, will do the right thing when it comes to a vaccine. Radio-Canada, good morning, Mr. Trudeau. We're entering a new phase, new projections, the possibility of a second wave. What is the importance of wearing a mask in this context? Now, will you wear one? It has been strongly recommended, but there is still people who don't wear a mask in public. Does that concern you? Well, I think everyone will have to make their own decision. But I do believe that there are many Canadians who have been following public health and experts' advice. That's what I've been doing. I wear a mask when I go to the office or when I'm close to people, when I believe I cannot keep a 2-meter distance from others. This is a personal discipline that I have been practicing, and I'm sure many other people are doing it as well. Now, if we really want to prevent that second wave from happening, as we relax some of the restrictions that have been affecting the general population, individual measures will be very important. Keeping one's distance, washing one's hands, not touching your face, wearing a mask when you can't keep a 2-meter distance from others. That is how we can ensure that there won't be a second wave, or that the second wave, if it happens, will be minimized. We have to remain vigilant until we develop a vaccine and it's accessible to everyone.
Obviously, I think it's important that people continue to follow public health advice. Even as we are loosening population controls, loosening rules around businesses and leaving home, it's going to be really important that individuals continue to behave carefully and in responsible ways. Our local public health officials are encouraging continuing to keep 2 meters distance. When you can't keep that 2 meters distance, to wear a mask. Certainly that's a choice that I'm making in order to keep myself and others safe. It is going to be really, really important that everyone remains attentive and vigilant to their own behaviors so that we can prevent a second wave from arriving, as we've seen in many places around, we're beginning to see in places around the world, but also so we can minimize any wave if it does hit. It's on Canadians individually, and that's why I have tremendous confidence, because we've seen how Canadians have acted and reacted over these past months, which has allowed us to get to this next phase.
With respect to NAFTA coming into effect in 2 days, the dairy industry made sacrifices. The aluminum industry made sacrifices. We made concessions to the U.S. in order to solidify our access to the U.S. market. And the agreement is not even in effect yet, and there is already talk of tariffs on aluminum and other goods. Well, with the new NAFTA, we were able to protect our cultural industries in the digital era and for the future. We were able to ensure better protection for our auto industry. And the most important thing is that we were able to continue to protect our privileged access for thousands of Canadian businesses to the U.S. market at a time of protectionism and uncertainty around the world. So we were able to protect our access for Canadian businesses to the U.S. market, and that's extremely important. Now, it's true that we have been hearing some concerning proposals about tariffs on aluminum, and we will continue to point out to the United States that they need Canadian aluminum for their industries, including the auto industry, and for technology industries across the United States, since they do not produce enough in the United States to meet their own needs. And increasing the price of aluminum for their workers and for their U.S. companies is a bad idea. Once again, we see that our economies are closely integrated, and we will continue to point that out to the U.S. administration.
We're moving forward on a renewed NAFTA that achieved many important gains for Canadians. Protections on intellectual property, protections for our auto industry, protections on cultural industries, which was extremely important right across the country, not just in Quebec. But most important of all, we secured Canada's access to the world's largest market in a privileged way at a time of protectionism and uncertainty. And that is something that makes a huge difference for Canadians and for Canadian businesses, and indeed for investors around the world, that Canada continues to have protected and privileged access to the United States. In regards to aluminum, we have heard, obviously, the musings and proposals from the United States that perhaps there needs to be more tariffs on aluminums. What we simply highlight is the United States needs Canadian aluminum. They do not produce enough, nowhere near enough aluminum in the States to be able to fill their domestic manufacturing needs. Therefore, if they put tariffs on Canadian aluminum, they're simply increasing the costs of inputs, necessary inputs to their manufacturing base, which will hurt the American economy. Again, we see that our economies are so interlinked that punitive actions by the United States administration end up hurting Americans the same way they end up hurting Canadians. That's why we will continue to advocate for continued free and fair trade between our two countries in a relationship that has been extraordinarily beneficial to our two countries for many, many decades.
Brian Mullen, Global News. Prime Minister, to follow up on an earlier question, Human Rights Watch says Canada may be unlawfully withholding or limiting effective consular assistance to the 47 Canadians, including 26 children, detained in northern Syria. What's your response to this specific allegation? Is your government deliberately withholding assistance?
The primary preoccupation of any government needs to be the safety and security of its citizens. And in this situation, the safety and security of our diplomatic personnel needs to be top of mind, particularly at a time of COVID, but in regular times as well. We will continue to work through third parties to try and provide consular assistance to Canadians, but Canada, unlike many other European and international partners, does not have any Canadian personnel in Syria.
Canada does not have any personnel on the ground in Syria, but we will continue to work with our international partners. The protection of our diplomatic corps and Canadian workers is always our top priority.
To assist their citizens over there. So is the government deliberately withholding assistance?
You know, we continue to be a government that looks to support Canadians in difficulty overseas. It's something that we've done consistently over the past years and will continue to do.
Prime Minister Kevin Gallagher, CTV National News. I just want to follow up on this Human Rights Watch report. This inaction that they're saying obviously leads to Canadian nationals being subject to torture, inhumane conditions. It's a serious allegation here from this organization. How does it affect your ability? You've often stood up here and talked about how you are never afraid to stand up for human rights on the world stage and bringing those issues directly to other countries that are accused of this. How does this report now affect your ability and credibility to do that?
As a country, we have always stood up to condemn the horrific actions in the Syrian civil war, the terrible actions by terrorists in the region. We will consistently stand up and defend Canadians and defend citizens' rights to live in safety and in peace. We have a responsibility as a government to ensure that Canadian citizens, particularly employees, are not put into danger, are not exposed to grave situations. Syria is an area where we do not have any diplomats or any Canadians on the ground, and therefore we work through intermediaries to try and provide consular assistance as best we can.
We will continue to condemn violence in the Middle East. We know that it destabilizes not only people living in the region, but it affects people around the world. But we must ensure the safety of Canadians, and that's why we're working with other partners to help Canadians in difficulty.
Charities, Canadian government has outsourced this student grant program. The Conservatives have asked for the Auditor General to look into it, but I think I want to ask you, how will there be accountability for Parliament with this, $900 million program being outsourced to a third party?
The Government of Canada has extensive practice of working with third parties, charities, to deliver programs. When we wanted to move forward to help various food banks across the country, we worked with the charity Food Banks Canada in order to deliver the program. When we wanted to help grassroots community organizations, we worked with United Way in order to deliver that program. The We charities are evaluated by our public service as being the best and only organization able to deliver on the scale that we need to make sure that young people have service opportunities this summer. We saw 25,000 young people from every corner of the country apply just over the past few days to be able to serve their country, and we know that this is something that is going to be extremely important in the coming months. Okay.
The Government of Canada regularly works with third parties or charities to deliver programs on food security. In one case, we delivered the program with Food Banks Canada. Or we may work with United Way, and that's what we did at the beginning of the pandemic to deliver certain programs. We will continue to work rigorously with certain organizations to provide more help for Canadians, and the WE organization is in a very good position to deliver this program right across the country. And in fact, in the last 2 or 3 days, we've seen some 25,000 young Canadians apply for the program so they can serve their community. So it's clear that young people want to get involved, want to volunteer, and serve their communities and their country. And we have to encourage them.
Prime Minister Tom Perry, CBC. On the Human Rights Watch report, I'd like to ask you, is your government in any way reluctant to help these particular Canadians, given their connection to ISIS?
We recognize that we need to try and help all Canadians. It is more complicated when we talk about the fact that a number of these people could face charges when they return to Canada for their activities linked to terrorism. But the engagement that we need to have with people around the world in order to make sure that they're getting the support that they have a right to as Canadians continues to be something we worry about.
Of course, in some of these cases, individuals were charged or faced accusations when they returned to Canada for supporting terrorist or activities. But at the same time, we have an obligation to help Canadians, whatever their situation. And that's always something we will seek to do.
You're saying that they're the only ones really who can do this job. Can you explain why that is? Why is it? What skills do they have that no one else does? And also, some volunteer organizations say that you're blurring the line between paid labor and volunteer work. What do you think about that?
The WE organization is the largest national youth service organization in the country. They have networks in every corner of the country and organizations that they work with. They already have worked over the past many years to deliver service opportunities to young people in every corner of the country. And quite frankly, when our public servants looked at the potential partners, only the WE organization had the capacity to deliver the ambitious program that young people need for this summer that is so deeply impacted by COVID. On the issue of service and volunteerism, we know thousands upon thousands of young people want to step up and engage in their communities, serve in their communities, help their country and their fellow citizens through this difficulty, while at the same time developing important work experience. The idea of giving bonus grants to young people who serve has long existed, and we know that it is something that is really important to recognize the value of service. But these young people will be volunteering in ways that will make a huge difference right across the country.
When the public service looked at the various organizations across the country that could help us to deliver service opportunities in every corner of the country on a scale that would affect thousands of Canadians, only the WE organization turned out to be capable of doing that. They have the connections and the network and the experience for having already delivered similar programs right across the country. And therefore, we will be profiting from their experience in this case through this program that will help thousands of Canadians to serve their communities. And the idea of giving some recognition and support to these Canadian youth is something that's well known in the volunteer context. And we, as a country, will be able to recognize the importance and value of that volunteer work. And I think it's important to realize that young Canadians have so much to offer their communities for our future and right now. And that's why we will always be there for them.
All right, that is the Prime Minister of Canada on this Monday morning with his no longer daily briefing, as he made clear as we move into July. And of course, as we come out to a different phase of this pandemic, the Prime Minister and public health officials will scale back what were daily press conferences up until the past couple of weeks and simply come out a couple times a week or when is needed to bring us news. So that too, a sign that it's summer, but also a sign that we're moving into a different phase of this pandemic. I'll bring back Vashti and Catherine just before we we get to the top of the hour, when public health officials will bring us some of those new modeling numbers that the Prime Minister indicated show that we're moving in the right direction. But the Prime Minister also did announce an extension to another program, Vashi, one that I know you were tracking a lot, because the uptake didn't seem to be necessarily moving in the right direction, and that's commercial rent.
Yeah, this was a tough one right from the start because, of course, commercial rent or rent period is provincial jurisdiction. Some provinces moved fairly quickly out of the gate to issue moratoriums on commercial evictions, but others didn't. The federal government stepped in. I think it was in late April. I could be wrong there. And basically worked out a deal with the provinces to backstop help for tenants, but through landlords. So it was all predicated on landlords agreeing to take a bit of a cut to their rent, a quarter of their rent, which to landlords isn't just a bit, but certainly they had to agree to that. And then the tenant would pay a quarter of it, and the rest would be subsidized by the federal government. It applied to April, May, and June, and what the Prime Minister announced today is that it'll be extended another month. That certainly will come as a relief to the people who are participating in it, because rent is due on Wednesday, and we had already been hearing, or I certainly had been, I'm sure you have too, from business owners who are still concerned about fixed costs that they're dealing with. It's true, the Prime Minister, as he mentioned, and the federal government have made available that emergency loan, which is $40,000 that, you know, hundreds of thousands of businesses have taken them up on, but that only goes so far. And as we see this reopening process take place, what we have realized very, I think, acutely is that it doesn't happen overnight, and the business doesn't come back right away. And especially if you think about a restaurant that just 2 weeks ago got the green light to open up 50% of its patio, you're talking about being, a quarter or maybe of the capacity that you normally could host in a restaurant. So lots of businesses still struggling with those expenses. And I did get some numbers, as did Phil, your producer, from the Department of Finance, because I was curious about the uptake. Our colleague Janice McGregor had reported quite extensively on this program, in particular the commercial rent assistance. And at the time, as of June 8th, there were 5,500 tenants that had been able to benefit from it, representing about $39 million in funding. As of June 25th, the latest numbers the department has is that 23,500 small business tenants had been approved or funded, representing about $178 million in approved funding. So that sounds okay, except for when about $3 billion was originally allotted for it. So it's not quite the uptake that anyone had expected. As sort of a silver lining to that, I guess, if you could put it, and it's definitely not positive, but many of the provinces had been waiting, I'm thinking particularly of Ontario, to see what the uptake in this program would be before issuing moratoriums on evictions. And since they realized a few weeks ago that the uptake was not great, they have issued those moratoriums, at least for the duration of this program. So that hopefully will also be extended another month, offering a bit of relief to a lot of these businesses, which, as I mentioned, are still dealing with a lot of stress and a lot of financial pressures on them.
Well, it's moving in the right direction in terms of uptake, I guess. People are getting access to it, although you're right, not what they expected at all. I'll just get you, Vashi, and then I'll move to Catherine to weigh in too on the human rights report out today, suggesting that Canada needed to do more for citizens in Syria. And I should point out that these are, yes, Canadian citizens, but they are also citizens who have alleged ties to ISIS, who in some cases went over to Syria to fight for ISIS. And the human rights is raising the alarm bell about what Canada should do, if anything. But it is a very complicated situation, and I think the Prime Minister reflected that.
Yeah, that's the exact word that I was going to use. It's extremely complicated. It's extremely complex for a number of reasons. First of all, just logistically, right? The idea that, and most of these Canadians, not the children, so 26 of them, Human Rights Watch says, are children. Some of them under the age of 6. But the adults are mostly Canadians who went over there to fight with ISIS. At least that's the allegation. And they're now being held, some of them by the Kurds, for example, some of them by other groups in northern Syria. The conditions under which they're being held are terrible, according to Human Rights Watch. And there are a number of academics in this country that have done extensive research on them. I'm thinking of Amarnath Amarasingham, Jess Davis, as well as Leo West. They've gone over there. They've seen the conditions. It's not good, right? But there is this. So logistically, going over there to get them and bring them back is a problem because, as the Prime Minister points out, there are no consular services there. Canada doesn't have a diplomatic presence in Syria. It's further complicated by the politics around all of this, right? And I actually found it interesting today that the Prime Minister's tone, I would say, has shifted a little bit from what we used to hear from Ralph Goodale when he was Public Safety Minister, who took a very hard line against this. And actually, the primary argument they used before the sort of logistics of all of this was, we don't think we should go over there to at least rescue the adults or bring the adults back because, A, the burden of proof if we bring them back for actually charging them or convicting them with terrorism is extremely high. It's very difficult to do in Canada. But B, they made the choice to do this, and I'm paraphrasing, they will suffer the consequences. That is essentially the argument that Ralph Goodale used to put forward. The Prime Minister led today not with that argument at all, but rather the logistics of it, the difficulty and the danger that you might be placing Canadian, for example, consular officials in if they were to go repatriate people who are in those who are detained over there. Now, as our colleague from the Globe and Mail pointed out, there are a number of countries since this sort of call to action was first made over a year ago, that have repatriated their citizens. The UK, France, and the US among them. Now, not all of them, but they have done a certain amount of repatriation. So why not Canada? The Prime Minister didn't have really a specific reason other than it's not plausible. It's not easy to get over there, and you might be endangering Canadians' lives. But I think that word complicated becomes extremely pertinent here when you think about the kids, right? Many of these kids did not go over there to fight with ISIS. It's not, you can't use the same sort of moral argument that you would for the adults. And I think there have been signs that the federal government is interested in doing something, but I can't see based on what the Prime Minister said that happening anytime soon.
No, and I should say that the Foreign Affairs Minister, when he responded to this report, said if Canadian citizens make their way to a consul, for instance, in Turkey, and say that they need help, they will be helped. But it is not the Canadian government's, it sounds like, intention to go in, nor can they go into a conflict zone to try and rescue Canadians who would, as the Prime Minister rightly points out, undoubtedly be charged upon returning to Canada for their alleged crimes. Thank you for that, Vashi. I'll go to Catherine now as we wait for Canada's Chief Public Health Officer, Dr. Theresa Tam. I found it interesting, Catherine, that the Prime Minister, while highlighting that the modelling numbers we're about to get today are good, show that we're moving in the right direction, that we have to be careful. And he was also asked extensively about masks, because that has become a growing debate in this country too, about mandatory mask wearing in public places.
Yeah, and talked about a lot about his own behavior as an example, and I think really tried to keep the focus on the positive about how this is ultimately on the shoulders of all Canadians, but that he has faith that things will be well because of that he essentially believes in Canadians. I was, Rosemary, going back and looking at some of the comments we heard from Dr. Tam, as Vashi pointed out earlier, June 4th, the last time she gave us these modelling projections along with Dr. New. And in fact, she did say then that the largest number of cases were young adults, middle-aged adults. That was even at that time, and really has been throughout this, where we're seeing the greatest number of cases. We know, of course, when it comes to the greatest number of deaths, though, that those are people above the age of 60. She talked about last time 82% of the deaths actually being people who are in long-term care facilities. Now, we've been talking today about another group of vulnerable people in this country, though, who are being hit by this. Farm workers are often coming from, migrant workers coming from overseas, living in close quarters. Another thing, though, that Dr. Tam said last time that I think we can expect to hear once again, a lot of attention made to her comments about explosive growth, the potential for explosive growth as Canadians start to let their guard down. So I think we're going to want to hear from Dr. Tam today, and no doubt she will talk about it, where she sees us as being now that we are in this place of loosening some of these restrictions. You know, when we first talked about these modelling numbers, I think a lot of the emphasis was on the longer term and what sort of picture public health officials were working with. We all know it's not a crystal ball, but where were we going? But we now understand that there is such a broad range of scenarios that, in fact, these updates are often most useful for understanding, okay, where are we right now? Where have we been in the past few weeks? Perhaps where we'll be in the next few days. But those kinds of big picture projections, really, there's just so much variation. And what's happening you pointed to the examples of Windsor, Essex, and Kingston, you know, They are ultimately, in the grand scheme of things, two smaller examples, but I think very potent examples in showing us how things can go. New Brunswick as well, we think of as a province that was without cases and suddenly saw that turn around quite quickly.
Yeah, it's about the flare-ups and then how we respond to them. That's right. Okay, thank you both very much. I'm going to just squeeze in an interview, if I can, before the public health officials come out. Colin Furness, he's an infection control epidemiologist and assistant professor at the University of Toronto, and he will hopefully come back after, too, if we need to talk to him and help us understand more the numbers. Good to see you again, Mr. Furness. Let's just leave where Catherine talked about there, the fact that we are seeing what I think, I don't know if they are hotspots or flare-ups, however we want to characterize them, places in the country that have had outbreaks. And how important is the response to those kinds of things? How worrying do you see some of these cases, whether it be Windsor, Essex, or in Kingston, for instance?
There will be flare-ups. That's the word I like to use because it doesn't have to accelerate all the way to an outbreak or even to hotspot. Those are pretty intense words. They're going to happen for two reasons. One is that there is still circulating COVID. There just is. And it's simmering, it's underground, but it will pop up from time to time. Also, there is increasing travel, which is extremely concerning to me. But travel explains the New Brunswick cases. Certainly travel explains the Windsor-Essex cases. So we've got both of these to contend with, and they're a fact of life at this point. No matter what your track record is, as a town or a public health unit, there will be flare-ups, no question.
The other thing we were discussing out of these numbers that we've seen on the Public Health Agency's website today is that, yes, the highest number of cases continues to be in that age category of over 80, but now there are more cases in the category of young people, 20 to 29. That to me seems very worrying, even if it doesn't lead to death or very serious cases. What do you think is going on there?
I think back to when I was in my 20s and how I would have managed my own behavior during this time. I think I would have likely, to be honest, constructed a little logic, a little narrative to myself that says, I'll be okay, I'll be safe. I'm not causing anyone any harm. And so I think, I'm not really expecting anyone else to be any better than me. I think that people in their 20s are very interested in socializing. Social life matters a lot. I think the lockdown affects people in their 20s very heavily when your social life matters that much. And so I think there's been a lot of rule breaking. And I also think that 20-somethings generally will look at the statistics and say, this is just going to be a cold for me. Yeah. Worst case, if I get it, it's not going to be so bad for me. Of course, they don't necessarily realize that they may get it and spread it and cause a lot of suffering and death without realizing it. So it's invisible, and it's really hard to protect and to change your behavior when something's invisible.
Yeah, I was going to say, I mean, the fact that you know that you are unlikely, percentage-wise, to die from it, and unlikely even to get severely ill, probably allows people in that age category to be, as you say, and I probably would have been the same, to not always follow the advice as closely as they should.
Yes, I think that is what we're seeing. However, if enough people in their 20s get infected, you will see complications, you will see severe cases, and you will see death. And I'm really hoping we can avoid that.
Let me ask you about the United States, because we talked about that a lot off the top as well. There's now, I think, more than 30 states that are seeing increase in cases. Obviously, some of these states have just reopened too quickly or are now having to dial some of this back. But when you think about the fact that the border remains closed till the end of July, it's hard to imagine it reopening anytime soon to recreational travel. But knowing we are in proximity to that kind of ongoing outbreak, what are your concerns around that? Because there is some travel happening. It's essential travel, but it's still happening.
It frustrates me that we have still not defined what essential travel is. If I feel self-important enough, I could say my travel is essential. We need to minimize it as much as possible. We obviously need trade goods. We need food. There's all sorts of things that need to cross the border, no question. There is some legitimate essential travel. If it's kept to a very small amount, then we can actually enforce the quarantine orders, the idea that self-isolation has to happen, and we're going to enforce that and track that. You can't do that with thousands and thousands, but you can do it with hundreds and hundreds. So we're going to need to keep that border closed. My guess is that it's going to have to stay closed for more than 12 months. That's not something people are talking about, but it's hard to imagine what's going to happen in the U.S. until we have a vaccine or until the population has been sufficiently infected that you have herd immunity. And to be honest, I think that's more likely.
Really? You expressed some concern just around travel. Do you mean travel within Canada as people sort of think about summertime and what they want to be doing? Do you not think anyone should be doing any travel at all? What are your thoughts on that?
I think travel can be done safely. If we're talking about domestic travel, international travel would not, if it were up to me, there would be no international travel that was not absolutely essential, full stop. And I see a lot of advertisements for airlines promising, as of July, to be flying people wherever they want to go. And I'm concerned about that. Yeah. For domestic travel, I am not at the point where I feel faith in our airlines' interest in public safety here. The ads I see and what I'm hearing from people around how full planes are, they can't operate at a profit and also protect people from COVID. And I'm afraid profit is going to win. And I honestly, it's not an easy thing to say, but I think airlines should be taking their marketing budgets and using that to mothball planes. We need to have less travel, and maybe one way to do that is to make it more expensive. It can be done safely, but it can't be done safely and profitably because you can't pack airports and you can't pack airplanes the way they're used to doing it.
Well, you saw, though, over the weekend that WestJet and Air Canada, well, I think it was Friday, both announced that they are no longer removing those middle seats, that they're putting everyone back in with no physical distancing, unless you call ahead and demand some extra space. They are not giving it to you anymore.
If it were up to me as the federal government, I would step in and I would impose a fee on tickets for the aisle and the window to pay for the middle seat, to make sure that it stays empty. It's a good example of the airlines, I think, acting in a way that I understand why they're doing it, because they can't operate at a loss, but I also think it's unacceptable to operate unsafely. I would worry that airlines would be subject to class action lawsuits down the road. There's nothing I can imagine worse than sitting shoulder to shoulder with a bunch of strangers for hours on end. That's how COVID moves. That's exactly what COVID is looking for. And I just don't trust airlines' ability to operate safely and at a loss at the same time.
Let me ask you one last question before I let you go. I appreciate you letting me pick your brain like this on TV. We have seen some increases in the weekly number of new cases per day in Alberta, in Manitoba, and in Saskatchewan. And I cite those places because Manitoba and Saskatchewan in particular had done very well for weeks and weeks. Saskatchewan's rate has now almost tripled, although it's still in a very small number of cases per 100,000. But when you see those upticks, and when people who live there see those upticks, how should they feel about them? How should they respond to them? It's normal, or we should be concerned, or how should they respond to those things?
It's a bit of both. It's to be expected, but it is also very concerning. The big question I would have for those provinces is how on top of contact tracing are they? Do we know where the cases are happening, and can we shut that down? I worry about workers in hair salons, for example. I worry about grocery store clerks. There's a lot of people with occupational risk I worry about. I worry about restaurants and bars and patrons as well. There's a lot of places we can point to say that's risky. If we actually collect the data where people are getting sick, then we can design interventions to make that stop. So it's not the number of cases, it's not even the rate, it's the knowledge of where the transmission is happening, and can we then enact interventions to make that stop, and can we do that quickly? That's what matters.
Yeah, well, when you see what's happening in Kingston at the nail salon, one person infected, now it's 26 people, and now they're contact tracing 3,000. I mean, that does give me some reassurance that they're able to test that many people.
That's exactly how to stay on top of this. That's how exactly to keep the second wave limited to small local outbreaks. I think personal care services are the new canary in the coal mine. It used to be grocery store workers when there was a lot of community spread. Now it's going to be people who are doing close face-to-face work. Dental hygienists I worry about, but I know that they know how to protect themselves. But hair care workers, nail salon workers, maybe tattoo artists, people who are up close. Occupationally, that's where I'm extremely worried, and we should be doing random, proactive testing of those groups.
Yeah, okay, Mr. Furness, thank you so much for making I'm supposed to call you Colin because you don't like to be called Mr. Furness. So Colin, thank you so much for making the time. I appreciate you letting me pick your brain on all that stuff very much. Thank you. Colin is an infection control epidemiologist and assistant professor at the University of Toronto. Colin Furness. All right, we are standing by and waiting to hear from our own federal public health officials on updated modeling. You'll remember that it took a number of weeks to get the federal department to put forward the modeling number, and now I think we're on our third or fourth time of getting these updated numbers, and it seems to be something we are better able to digest and take in and understand what they mean. Obviously, a snapshot of where we've been and sometimes a sense of also where we're going. A couple other things, though, that the Prime Minister highlighted that I want to highlight as well. First of all, on July 1st marks the entry into force of the new NAFTA. It's also Canada Day, so unlikely that there'll be big NAFTA festivities, but he wanted to make the point that is in fact happening on July 1st, so on Wednesday. And on Thursday, July 2nd, the province of Ontario will be the first province to start testing the new contact tracing app that the Government of Canada announced a couple of weeks ago now, that the Prime Minister himself announced. And that, of course, is meant to try and give you a sense of whether you or your phone have been in contact with someone who has tested positive for COVID-19. All right, I can see Dr. Theresa Tam there making her way into the press conference. And obviously that contact tracing app starting in Ontario, but the government's goal would be for it to roll out nationally and for many people to download it. It doesn't use geolocators, it uses Bluetooth, so they say there's a certain degree of protection of your privacy around that. Okay, let me bring you now back to that press conference in Ottawa with the Chief Public Health Officer, Dr. Theresa Tam, getting ready to give us her latest modeling numbers for the coming months in this country. Here she is.
Good afternoon, bon l'après-midi à tous. Today I'll be sharing an update on the national epidemiology and the modelling work that we're using to inform ongoing control of COVID-19 in Canada. But first I'll begin by providing the latest numbers on COVID-19 in Canada. There have been 103,250 cases reported in Canada to date, including 8,522 deaths, and 64% of those with COVID-19 have now recovered. Labs across Canada have tested over 2,676,000 people for COVID-19 to date. And over the past week, an average of 36,767 people were tested daily, with 1% testing positive. These numbers do change quickly, and they are updated daily in the evenings on canada.ca/coronavirus.
Bonjour. Je fais aujourd'hui le point sur les travaux scientifiques d'épidémiologie et de la modélisation qui guident nos efforts visant à assurer le contrôle continu de la COVID-19 au Canada. Pour commencer, je vais vous présenter les derniers chiffres sur la COVID-19 au Canada. 103 250 cas ont été déclarés au Canada à ce jour, dont 8 522 décès.
122 deaths. 64% of the cases have now recovered. Labs across Canada have tested over 2,676,000 people for COVID-19 to date. Over the past week, an average of 36,767 people were tested daily, with 1% testing positive. These numbers change quickly and are updated daily in the evenings on canada.ca/coronavirus.
Slide 2. I'll begin with an update on the latest epidemiology. And slide 3. Although most health regions in Canada have reported cases, this map showing the incidence rate per 100,000 population illustrates that some areas have experienced more activity than others. In particular, Quebec and Ontario have had some heavily affected areas, and considering their larger populations, these jurisdictions account for 86% of our cases overall. Currently, hotspots linger with persistent community transmission in and around the Toronto and Montreal. So in looking at the boxes to the right, the lower box shows that the proportion of cases who died has remained at about 8%. This case fatality ratio changes over time as new cases and deaths are reported. Based on the available information, 15% of cases have required hospitalization, and just over 3% have required intensive care.
Je vais maintenant faire le point sur les derniers données.
I'll begin with an update on the latest epidemiology of COVID-19 across Canada. Slide 3. Although most health regions in Canada have reported cases of COVID-19, this map showing incidence rates per 100,000 people illustrates that some jurisdictions and regions within have experienced more activity than others. In particular, Quebec and Ontario have had some heavily affected areas, and considering their larger populations, these jurisdictions account for 86% of cases overall. Currently, hotspots linger with persistent community transmission in and around Toronto and Montreal. If we look at the boxes to the right and the lower boxes regarding deaths, the proportion of cases who died has remained at about 8%, reflecting the tragic impact on Canada's seniors in long-term care. This case fatality ratio changes over time as new cases and deaths are reported. Based on available information, 15% of cases have required hospitalization and just over 3% have required intensive care.
Slide 4. These graphs showing that daily numbers of new cases and deaths on top and the daily totals of hospitalized and critical case patients on the bottom. They all illustrate the steady decline in COVID-19 activity since the peak of the epidemic in late April. Monitoring these indicators tell us that our public health measures have been successful in slowing the transmission in the community, particularly as all four show a steady decline.
Maintenant, la diapositive 4.
Now for slide 4. The graphs showing daily numbers of new cases and deaths on the top and daily totals of hospitalized and critical case patients on the bottom illustrate the steady decline in COVID-19 activity since the peak of the epidemic in late April. Monitoring these indicators tells us that our public health measures have been successful in slowing the transmission of COVID-19 in the community, particularly as all four show a steady decline.
Slide 5. Another indicator of epidemic control is the effective reproduction number, or RT. This number represents how many people are infected by each new case. In order for the epidemic to die out, RT needs to remain consistently below 1, meaning on average, each new case infects less than one other person. Nationally, the RT for Canada has been below 1 for more than 8 weeks. At this point, with transmission under control in jurisdictions across the country, fluctuations in RT at the national level, which you see in the sort of green shading if you have the graphs in front of you, are now a result of smaller numbers and localized outbreaks.
Diapositive 5.
Slide 5. Another indicator of epidemic control is the effective reproduction number, or RT. This number represents how many people are infected by each new case. In order for the epidemic to die out, RT needs to remain consistently below 1, meaning on average, each new case infects less than one other person. Nationally, the RT for Canada has been below 1 for more than 8 weeks, which is good news. At this point, with transmission under control in jurisdictions across the country, fluctuations in RT at the national level are now a result of smaller numbers and localized outbreaks.
Slide 6. So all age groups have been affected by this pandemic, although incidence among children and youth has remained relatively low throughout. On the left, the sharp peak in incidence among adults aged 80 years and older, which is the green line, is largely attributed to outbreaks in long-term care homes. As the epidemic has slowed, the incidence rates have steadily declined in all age groups, though the decline has been relatively slower in younger age groups. Because transmission rates are declining so steeply in the oldest age groups, individuals under the age of 40 now account for a greater proportion of total cases in recent weeks.
Diapositive 6.
Slide 6. All age groups have been affected, although incidence among children and youth has remained relatively low throughout. On the left, the sharp peak in incidence among adults aged 80 years and older, the green line, is largely attributed to outbreaks in long-term care homes. As the epidemic has slowed, incidence rates have steadily declined in all age groups, though the decline has been relatively slower in younger age groups. Because transmission rates are declining so steeply in the oldest age groups, individuals under the age of 40 now account for a greater proportion of total cases in recent weeks.
Slide 7. The epidemiology of COVID-19 in Canada is a composite of different regional epidemics. This slide shows Canada's 3 largest outbreaks across the top. All have experienced significant community spread and daily cases into the hundreds, especially in Quebec and Ontario, and to a lesser extent, Alberta. The center row shows provinces with outbreaks and limited community transmission, with daily case counts remaining below 100, and transmission now largely brought under control. The lower row with daily case counts in the low double digits show provinces that experience isolated and largely contained outbreaks with minimal to no community transmission. Finally, the multiple distinct peaks in the curves along the right-hand side for Alberta, Saskatchewan, and New Brunswick serves as reminders that resurgence can happen in any place and at any time, even in areas with no or low levels of transmission. Prince Edward Island, the Yukon, and Northwest Territories have had no community transmission, while Nunavut had reported no cases to date.
Diapositive 7.
Slide 7. The epidemiology of COVID-19 in Canada is a composite of different regional epidemics. The slide shows Canada's 3 largest outbreaks across the top, all having experienced significant community spread and daily cases into the hundreds, especially in Quebec and Ontario, and to a lesser extent, Alberta. The center row shows provinces with outbreaks and limited community transmission, with daily case counts remaining below 100, and transmission now largely brought under control. The lower row, with daily case counts in the low double digits, shows provinces that experience isolated and largely contained outbreaks with minimal to no community transmission. Finally, the multiple distinct peaks in the curves along the right-hand side for Alberta, Saskatchewan, and New Brunswick serve as reminders that resurgence can happen in any place at any time, even in areas with no or low levels of transmission. Prince Edward Island, the Yukon, and the Northwest Territories have had no community transmission, while Nunavut had reported no cases to date.
Slide 8. Current patterns of COVID-19 incidents, and this is in the past 14 days, show limited to no transmission in most areas of the country. But areas of increased incidence, shown as darker blue areas on the map, represent areas experiencing outbreaks, as seen in areas of Saskatchewan, and hotspots of persistent community transmission seen in and around Toronto and Montreal.
Diapositive 8.
Slide 8. Recent trends reflect community transmission hotspots and localized outbreaks. Areas of increased incidence, shown as darker blue areas on the map, represent areas experiencing outbreaks as seen in Saskatchewan, and hotspots of persistent community transmission as seen in around Toronto and Montreal.
Just to add that you can see also the Windsor-Essex area lighting up at the moment as well. So the next slide, slide 9. COVID-19 has exploited social and economic vulnerabilities and inequalities across Canadian society, taking hold in settings and among communities that experience overcrowding, lower incomes, and health disparities. Long-term care and assisted living homes have been hit the hardest, with over 1,000 separate outbreaks, accounting for about 20% of confirmed cases and tragically over 80% of all deaths. Outbreaks in other congregate living and work settings are also driving case counts in some provinces. These settings include hospitals, correctional facilities, shelters, and workplaces, including Canada's largest outbreak linked to a meat processing plant.
Diapositive 9.
Slide 9. COVID-19 has exploited social and economic vulnerabilities and inequalities across the Canadian society. It has taken hold in settings and among communities that experience overcrowding, lower incomes, and health disparities. Long-term care and assisted living homes have been hit the hardest, with over 1,000 separate outbreaks accounting for about 20% of confirmed cases and, tragically, over 80% of all deaths. Outbreaks in other congregate living and work settings are also driving case counts in some provinces. These settings include hospitals, correctional facilities, shelters, and workplaces, including Canada's largest outbreak linked to a meat processing plant.
I just want to point out also on this slide, we're looking at sort of more recent outbreaks or clusters, and these as society begin to reopen again, and these do include funerals and indoor family gatherings. Slide 10. So really, in summary, the epidemiology indicates that transmission is largely under control, while also showing us that cases can reemerge anytime or place. In today's modelling update, I'll talk about how we are using modelling to identify the combinations and intensity of public health measures we need to maintain control, stamp out outbreaks, and prevent a widespread resurgence of cases. Models provide a prediction of what could happen under hypothetical scenarios, allowing us to drive our public health actions towards a best possible outcome.
Diapositive 10.
Slide 10. In summary, the epidemiology indicates that transmission is largely under control in Canada, while also showing us that cases can reemerge at any time in any place. In today's modelling update, I'll talk about how we are using modelling to identify the combinations and intensity of public health measures that we need to maintain control, to stamp out outbreaks, and to prevent a widespread resurgence of cases. Models provide a prediction of what could happen under hypothetical scenarios, allowing us to drive our public health actions toward a best possible outcome.
Slide 11. Just as a reminder, Canada is aiming for strong epidemic control over the course of the pandemic, with less than 10% of the population infected overall. And thanks to the commitment of all Canadians who have been following public health advice to protect themselves and others, we are well on our way down the right side of the big first peak. Unfortunately, the novel coronavirus has not been eliminated, and we do not have an effective vaccine at this time. So as restrictive public health measures are being lifted to minimize the unintended health, social, and economic consequences, we expect to see some resurgence of cases. The key is to keep the number of cases small through ongoing core public health practices. We must be able to rapidly detect and isolate cases and quarantine their contacts in order to keep any resurgence to a small and manageable size.
Diapositive 11. Le Canada vise.
Slide 11. Canada has been aiming for strong epidemic control over the course of the pandemic, and less than 10% of the population infected. Thanks to the commitment of all Canadians who have been following public health advice to protect themselves and others, we are well on our way down the right side of the big first peak. Unfortunately, the novel coronavirus has not been eliminated, and we do not have an effective vaccine at this time. As restrictive public health measures are being lifted to minimize the unintended health, social, and economic consequences, we expect to see a resurgence of cases. The key is to keep the number of cases small enough through ongoing core public health practices.
Slide 12. Dynamic models are telling us that if we relax too much or too soon, the epidemic will most likely rebound with explosive growth as a distinct possibility. Modeling simulations show us that as we lift stay-at-home policies and business and school closures, we must strengthen other public health measures to maintain epidemic control. The enhanced public health measures include rapid case detection, testing, and timely contact tracing and quarantine to prevent new introductions and control any new chains of transmission in outbreak or community settings.
Diapositive 12.
Slide 12. These dynamic models all tell us that if we relax too much or too soon, the epidemic will most likely rebound with explosive growth as a distinct possibility. Modeling simulations show us that as we lift stay-at-home policies and business and school closures, we must strengthen other public health measures to maintain epidemic control. The enhanced public health measures include rapid case detection and timely contact tracing and quarantine to prevent new introductions and to control any new chains of transmission in outbreak or community settings.
Slide 13. Fast and thorough case detection and contact tracing means that cases, including any contacts that go on to become cases, will be less likely to spread infection to others. So the higher proportion of cases that can be detected and isolated early in the course of their illness, the fewer people they are likely to infect and will be less likely to spread infection to others. Likewise, when most or all contacts are identified early and placed into quarantine, fewer are likely to spread infection to others if they do become ill. So these modeling simulations illustrate the impact of rapid case detection, which is the graph on the left, and contact tracing, the graph on the right, combined on epidemic control. The faster we are, the more we drive the percentage of the population infected down. So I'm going to take a very brave attempt at taking you through a couple of these graphs. So just remember, we're trying to aim for the bottom of that y-axis, the lower percentage of people infected. So the red dot on the model on the left shows that if we detect cases within 5 days of becoming infectious, we need to reach more than 50% of all cases and isolate them to keep the epidemic under control. So keeping that dot low. The model on the right shows that if we trace contacts within 2 days of their exposure, we need to reach more than 50% of all contacts and quarantine them to keep the epidemic under control.
Okay, diapositive 13.
Slide 13. Fast and thorough case detection and contact tracing means cases, including contacts that go on to become cases, will be less likely to spread infection to others. The higher the proportion of cases that can be detected and isolated early in the course of the illness, the fewer people will be likely to be infected. Likewise, when most or all contacts are identified early and placed into quarantine, fewer are likely to spread the infection to others if they do become ill. These modeling simulations illustrate the impact of rapid case detection, which is the graph on the left, and contact tracing, the graph on the right. So it illustrates the impact of rapid case detection combined on epidemic control. As an example, the red dot on the model on the left shows that if we detect cases within 5 days of becoming infectious, we need to reach more than 50% of all cases and isolate them to keep the epidemic under control. The model on the right shows that if we trace contacts within 2 days of their exposure, we need to reach more than 50% of all contacts and quarantine them to keep the epidemic under control.
Slide 14. So the graph on the left, focus on that for now. Canada has been testing more people over time, with a lower percentage of testing coming back positive, indicating that our surveillance is sensitive and casting the net wide to pick up cases. If we switch to the right-hand side of the slide, the shorter the time interval between onset of illness and lab specimen collection, the quicker cases are detected and isolated to prevent further spread. So the graph on the right shows that this time interval has decreased over time from more than 8 days to around 3 days currently.
Diapositive 14.
Slide 14. Canada has been testing more and more people over time, with a lower percentage of testing coming back positive. This indicates that our surveillance is sensitive and casting the net wide enough to pick up cases. The shorter the time interval between the onset of illness and lab specimen collection, the quicker cases are detected and isolated to prevent further spread. The graph on the right shows that this time interval has decreased over time from more than 8 days to around 3 days currently.
Slide 15. Public health authorities are monitoring the number of cases that cannot be linked to other cases as a measure of effective contact tracing, with the aim of keeping this number to a minimum. So on the graph, this is the red part. The more cases that are unlinked, that is to say we don't know how they were exposed, the harder it is to stop community spread. Lower daily case counts right now facilitates contact tracing to link cases and break chains of transmission.
Diapositive 15.
Slide 15. Public health authorities monitor the number of cases that cannot be linked to other cases as a measure of effective contact tracing, with the aim of keeping this number to a minimum. The more cases that are unlinked, i.e. we don't know how they were exposed, the harder it is to stop community spread. Lower daily case counts facilitates contact tracing to link cases and break chains of transmission.
Slide 16. As society reopens, the average number of people we meet each day will increase, and there will be additional places and situations where there is a higher risk of virus transmission. These tables show different combinations of case detection and contact tracing that can keep the epidemic under control. So the colored cell shows successful combinations according to 3 modeling studies that will keep the epidemic under control. So the top table shows that with restrictive measures, school, university, workplace closure, for example, many different combinations can keep the epidemic under control. The lower tables show that with increasing numbers of contacts between people, it becomes increasingly difficult for public health to do case detection and contact tracing to control the epidemic. So there are less of those colored cells. Therefore, as society reopens and public health restrictions are relaxed, it is even more important that Canadians continue with collective efforts to maintain physical distancing and good hygiene to keep COVID-19 under control. This ensures public health capacity is not overwhelmed and can use case detection and contact tracing to control the epidemic.
Diapositive 16.
Slide 16. As society reopens, the average number of people we meet each day will increase, and there will be additional places and situations where there is a higher risk of virus transmission. These tables show different combinations of case detection and contact tracing that can keep the epidemic under control. Colored cells show successful combinations according to 3 modeling studies. The top table shows that with restrictive measures, for example, school, university, and workplace closures, while many different combinations can keep the epidemic under control. The lower tables show that with increasing numbers of close contacts between individuals, it becomes increasingly difficult for public health to do case detection and contact tracing to control the epidemic. Therefore, as society reopens and public health restrictions are relaxed, it is even more important that Canadians continue with collective efforts to maintain physical distancing and good hygiene to keep COVID-19 under control. This ensures public health capacity is not overwhelmed and can use case detection and contact tracing to control the epidemic.
Slide 17. So Canada has made significant progress to bring the epidemic under control, thanks to the commitment of Canadians maintaining public health practices to protect themselves and others. Across the country, jurisdictions continue to increase social and economic activity with appropriate conditions and controls in place to minimize spread of the virus. Due to the progress that Canadians have made, we will be decreasing the number of media availabilities that we'll be holding each week for the time being. We will be providing updates in person twice a week over the coming weeks unless there is something we need to urgently bring your attention to. We will also be issuing statements each day to keep you updated on the latest numbers and any news on the days that we're not holding immediate availability. So I want everyone to remember that the virus has not disappeared and resurgence can happen anytime or at any place. Until there is a vaccine or effective treatment, we need to continue to live with COVID-19 by balancing the risks of spread of COVID-19 with the unintended social and health consequences of restrictive public health measures. So you should ask yourself, if you do test positive, consider that the fewer people that you have contact with, the quicker and easier it will be for public health to trace them all down and interrupt chains of transmission to keep the spread of COVID-19 under control. Thank you.
Et finalement, diapositive 17. Le Canada.
Slide 17. Canada has made significant progress to bring the epidemic under control thanks to the commitment of Canadians maintaining public health practices to protect themselves and others. Across the country, jurisdictions continue to increase social and economic activity with appropriate conditions and controls in place to minimize the spread of the virus. Due to the progress that Canadians have made, we will be decreasing the number of media availabilities that we will be holding each week for the time being. We will be providing updates in person twice per week over the coming weeks, unless there is something we need to urgently bring your attention to. We will also be issuing statements each day to keep you updated on the latest numbers and any news on the days that we are not holding a media availability. The virus has not disappeared, and resurgence can happen at any time and in any place. Until there is a vaccine or an effective treatment, we need to continue to live with COVID-19 by balancing the risks of spread of COVID-19 with the unintended social and health consequences of restrictive public health measures. If you do test positive, consider that the fewer people that you have had contact with, the quicker and easier it will be for public health to trace them all down and interrupt chains of transmission to keep the spread of COVID-19 under control.
chaîne de transmission et d'assurer la maîtrise de la propagation de COVID-19. Merci.
Thank you.
Thank you. And there are some additional data that we have in the annexes to the slide, which we don't have time to go through all of them, but just an update on some of the ones that you've seen before. So thank you.
Thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une ou des deux langues officielles.
You can ask your question in either official language.
Follow up for those asking questions in the room. We ask that you make yourself your way to the freestanding mic. Over to you, operator, Émilie.
Thank you. Merci. Please press star 1 on your telephone keypad if you would like to ask a question. Veuillez appuyer sur étoile 1 si vous avez une question. Notre première question, our first question, is from Jordan Press with the Canadian Press. Please go ahead. À vous la parole.
Oh, good afternoon, doctors. Dr. Tam, I'm just curious about actually the first known case of COVID. I believe it was a gentleman who had flown back from China, and I'm curious, did he fully recover? Are we watching him in a scientific way? Were we able to trace any other cases of infection to him? I'm just curious if you can give us an outline of that very first case that has sparked an outbreak, a pandemic in this country.
So I think, obviously, any details should go to the local or provincial health authorities. As I recall, that particular individual was with a traveling companion or member of the family. I think there was a husband and wife. But as to what happened exactly to them, I think that is best answered by the local jurisdictions, and we don't sort of discuss those individual details based on privacy and other issues. But I think one point I think you're trying to make, perhaps, is that there's more and more information that we can learn about what happens to people, not just immediately after they got sick, their journey through their clinical illness, but there are more and more studies that is going to have to be ongoing, I think, to look at any longer-term impacts of COVID-19 on individuals. We're still at the sort of beginnings of learning about the impact of the virus.
It's Dr. New here. Maybe just add to what Dr. Tam said. Also, your question, you said that the first case you think, quote, sparked the, quote, the epidemic in Canada. I just want to be clear that this was the first case that was, detected, reported in Canada, and subsequent cases that were also reported in Canada had no connection to that first case. So it wasn't that this case then led to further chains of transmission. So I just want to be clear that, obviously there were subsequent cases which were detected sort of independently in Canada, and they weren't all linked to, quote, that first case, as you might have alluded to. Thank you.
Great. That's an important clarification. The initial cases were well managed. They didn't, those very first few cases didn't lead to further transmission that we're aware of.
Thank you, Doctor. A follow-up, Jordan?
Yeah, I just wanted to ask a little bit something else. You mentioned at the end of that we're going to have fewer of these briefings. So can you just maybe talk a bit about then what a typical bit?
You cut off, Jordan. Do you want to start your question again?
Oh, I was just kind of wondering, because you mentioned there's going to be fewer of these media availabilities, if Dr. Tam, you can describe a bit what your regular day has been like over the past few weeks, given everything you've been doing, and then maybe what the next few weeks are going to be like for you as you try to maybe recharge for the fall and a potential second wave.
Thank you so much for asking that question. Not many people have really asked me that. I think it is important to recharge. Right now, though, while we're not maybe doing every day during the week press conferences, there is no doubt that we're still working nonstop. A lot of the work that we're doing right now is not just to be extremely vigilant about this current phase of reopening and be able to address any little sparks of outbreaks quickly with the provinces and territories. It is also time to make sure we recharge everything so that we're ready for any resurgences. So recharging all around. But that is very important because I think most of the public health workers and anyone in the health system, but I know all of my colleagues have been working extremely hard. And I think on another interview, I was saying that I was probably working about 20 hours a day. That hasn't changed an awful lot right now. So I think I need to sort of take my own advice, perhaps, on people balancing their mental and physical health and trying to do that a bit better myself. Thank you.
Thank you.
This Dr. New, I just maybe add to what Dr. Tam said. Certainly, Dr. Tam, myself, we're still continuing with regular teleconferences with our counterparts in the Special Advisory Committee, with all the provinces and territories. And what she didn't mention is that she and I have been having active discussions to make sure that she takes some vacation time off, and I sort of cover for her and vice versa, because I do think that it's important that we, celebrate Canada Day coming up, and obviously our wonderful summer here in Canada. Thank you.
Thank you, operator. Next question.
Thank you. Merci. Our next question is from Philippe Vincent Foisy with Radio-Canada. Please go ahead. À vous la parole.
Oui, bonjour.
Yes, good afternoon. I have a question regarding immunity. People who are asymptomatic might be immune to COVID-19 or may not be. Is this concerning to you? Because we want to restart the economy. Does it concern you that saying that people who are asymptomatic have very low levels of immunity? Answer, it's Dr. New here. Science is continuing to evolve, and both of us have been closely monitoring what's happening in other countries and here in Canada. We are looking at serologic research. This is a concern. We know that people's immunity doesn't last long if they've been infected. This will have an impact on public health measures, and we need to keep these public measures in place. And it also puts more pressure on us to find treatment and a vaccine. For now, if immunity doesn't last, then this needs to be factored into our approach when we talk about a collective immunity. We're going to continue our research and find other treatment methods and a vaccine. But we also need to remember that the public health measures such as physical distancing, good personal hygiene, staying home if we're sick, these are all measures that are important to maintain. Follow-up question? Yes. You didn't mention masks, even though you recommend the use of them. A lot of people use them, a lot of people don't. We walk around a grocery store, we walk throughout the city, we go to different businesses, and there are still a lot of people who aren't wearing masks, who may find it useless. Is it concerning to you that a lot of people are not wearing masks? Are you going to make the wearing of masks mandatory in the coming months because it's an effective way to fight COVID-19 and it might slow a second wave? Answer, it's Dr. New again here. Perhaps Dr. Tam will have something to add afterwards. We know that wearing a mask, a face covering, is an additional measure that is important. It's also important, of course, to maintain the other measures such as physical distancing. This is something that we have always highlighted. If it's not always possible to maintain physical distancing if we have to take public transit, for example, or if we have to go to the grocery store. I believe that it's better to raise awareness. It's better to educate people so that they understand that it's a good habit to take. It's something that can be used for people to protect themselves and to protect others. I think that is more effective. It's more effective to encourage people to use them. We need to educate them instead of regulating. This is a measure that provinces and municipalities can consider. Certain municipalities have already put in place something more regulated measures, but I think that it's better if it's something that people can choose to do. If people realize that it's good for them and for others, I think they'll be more likely to do it. Dr. Tam?
Said a reminder to Canadians that this virus hasn't disappeared. I think another fact that became more, I think in terms of the evidence base, is that a lot of people are not symptomatic. Even if we don't know the extent to which asymptomatic people can transmit, there are studies show that they can. So with that in mind, as we go about leaving our homes and going outside in a safer manner to protect yourself and others, we recommend wearing a mask if you can't keep the physical distancing. And you can imagine a lot of these places are, as you said, the grocery stores or the public transport, etc. I think it is actually quite difficult to tell if the virus is still in your community, which I think is a general recommendation. But listening to your local public health as to what activity is there. But it's actually maybe much easier for Canadians just to remember, if you can't keep the 2-meter distance, remember that mask to protect yourself and others. So I know it's not easy to do, but I think it's a really important added layer of protection on top of the physical distancing, the hand hygiene, etc. One other message is that what we just said in the modeling presentation, try to keep the number of your contacts low, makes it easier, reduces your risk, but makes it easier also for public health to immediately do your contact tracing, that type of thing as well, at the same time as public health is increasing their capacity to do the rapid case detection and contact tracing. And the mask is just another added layer of protection. Don't forget the rest.
Thank you, doctors. Opérateur, prochaine question.
Thank you. Merci. Our next question, notre prochaine question is from Benjamin Vachet with TFO. Please go ahead. À vous la parole.
Oui, bonjour.
Yes, good afternoon. Regarding the data you shared today, it seems as though a second wave is inevitable. Is this what we need to remember from your presentation today? Answer. Thank you for your question. It's Dr. New here. With modeling, we've stated that this isn't a crystal ball. There may be a second wave, but when will this happen? People are saying that it could happen in the fall. We know today that if Canadians throughout the country set aside all public health measures, physical distancing, wearing masks, good health practices, well then, there could be another wave in 2-3 weeks. But if we maintain our public health practices, well, experts believe that in the fall, it will be colder, And with flu season and cold season coming up then, it might be important to plan for different outbreaks of other respiratory viruses on top of COVID-19. So we have to plan for this. But it's important to maintain the public health measures
to Toronto,
that are in place.
Premier Doug Ford is giving his daily COVID-19 update. Let's watch.
All clients of Kingdom Nail and Spa located at 625 Fortune Crescent, Kingston. If you have visited this salon on June 17th or between June 21st to June 25th.
But there's a small group of bad causing trouble, lighting trucks on fire, smashing windows, and getting mixed up in organized crime. That ends now. I've been hearing it from our mayors, industry leaders, the police chiefs, and OPP.